a pathologist at University Hospital, and I'll talk to you today specifically about how we in the laboratory diagnose infections. I'm in charge of the parts of the lab that oversee testing for diabetes, cholesterol disorders, hormone problems, and other infections. And we in the lab, we have a lot of people behind the scenes working in the lab. So how do we diagnose these diseases and infections? Every day we deal a lot with numbers. We see 3,000 tests. We have blood sugar numbers that are 126. We look at cholesterol numbers. We measure sizes of tumors. And we have a lot of different statistics and numbers that we measure in the lab. But it's important for all of us to remember that behind every number is a life. We'll start telling a story of our patient. Our patient is a high school student. He's a wrestler, and he was just doing a wrestling meet. After a few days, he started to notice that the scrape started to feel a little bit different. It became a little bit red, had a little bit of oozing, became warm, and started showing this, kind of pus, kind of a purulent material coming out of it. Now, the next day, he started to develop a fever, and his mom noticed that he had this fever and wanted him to go to the doctor's office. The doctor in this case ordered a few tests. The first is called a complete blood count, or a CBC. The second is a skin biopsy, and then a wound culture. So where do these tests go? What do they do? Who is actually behind the scenes that's doing these tests and giving you the information? The first person that the patients often meet is the phlebotomist. The first step in this process to get the complete blood count done is to go have the blood drawn. Now, the phlebotomist is the person that actually draws the blood. So that's the first member of our laboratory team. The medical technologist is the person in the laboratory that actually does the testing. So the medical technologist will get that tube of blood and they'll decide what tests needs to be done on it. So in the case of our patient, the medical technologist took that blood, took a small sample of it and put it on that instrument or that machine, an analyzer. What the machine does is takes a small bit of that blood and does a test on it. In this case, the machine counts how many different blood cells that patient has. When the results come out, the medical technologist has two choices. Sometimes they'll look at the result on the instrument and they'll just give that number right to the doctor without doing anything else. Sometimes they'll look at that result and see that additional testing needs to be done. So the next step that the medical technologist did in this case was actually take another small sample of that blood and take a little bit out and smear it on a glass slide and stain it with special dyes so that you can look at cells. So on the left side here, you see two of these purple cells or two of these white blood cells, and that's a normal patient. On the right side here, you see a lot more of these purple cells, a lot more of these white blood cells, and that indicates that this patient has increased white blood cells, which means that they're trying to fight the infections. And in the laboratory, we call this leukocytosis, or increased white blood cells. We don't know what's causing the infection, so we need to do additional steps and additional tests. So the next test that we do is a biopsy. Now, a biopsy is usually done and taken by the nurse or the doctor in the doctor's office, where they take a scalpel or a knife or even a special punching instrument that will take a sample of the tissue and take this piece of tissue will be taken out, usually from the affected area. Once the biopsy tissue is taken, it's put in a formaldehyde container to preserve the tissue and take it to the laboratory. The next place that it goes into the laboratory and the next person that's responsible for helping diagnose this patient is the histotechnician or histotechnologist. The histotechnician is responsible for turning this piece of tissue, so the patient's skin, into something that can be looked at under a microscope and that somebody can make a diagnosis based on that tissue. The histotechnician will deliver it to the pathologist. Now, a pathologist is a doctor that's trained to look at slides under the microscope and diagnose the diseases and tell whether or not the tissue that they're looking at is normal, whether or not it has a cancer, whether or not it has some sort of infection or any sort of disease. This picture here is actually what skin would look like under the microscope. This tells us that the patient actually has a skin infection called an abscess. So now what we know from this patient is that his blood has an increased number of the white blood cells that are helping to fight the infection. And so we know his body is again making the right response, trying to fight this infection, and that these cells are actually centering around the source of the disease and the source of the infection. So the next step is to actually take a sample of this wound that he has, and this is called a wound culture. And this will help us determine what exactly is causing his infection. To do this, we take a cotton swab or something and actually take a sample of that wound. and this gets whatever organism, bacteria, or virus is causing the infection. So that's the job of the medical technologist. So what they'll do, they'll incubate it in a hot environment overnight or for 1 to 2 days, and during that time the bacteria will have a chance to grow. And now what you see is these white or gray smears and white and gray circles. These white and gray circles are actually clusters of bacteria, so growing, living bacteria that are grouping together and feeding off of the nutrients on that plate. So depending on the shape, the size, the structure, the clustering and pattern, and the color of the bacteria, the medical laboratory technician can tell what type of bacteria it is. So the next question that the doctors will want to know is, how do we treat this? What antibiotics will work on this infection? The medical laboratory technician or medical technologist will again take that sample of bacteria, smear it out on a different plate. Now these plates again have nutrients, but what they do in this case is actually put little circles, so these are circles or discs that have different antibiotics on them. They'll put them on the plate with the bacteria, give the bacteria a chance to grow in the hot environment overnight again, and see whether or not the bacteria were able to grow the next day. These clear circles around the disc show that the bacteria isn't able to grow in the presence of that antibiotic. And so that tells us that if you see a clear circle, that antibiotic will work. And a person that can help us determine the results of these antibiotic susceptibility tests, we call them, can be a clinical microbiologist. Sometimes they can do additional tests that will help them tell whether or not bacteria have developed the capability to resist an antibiotic. And bacteria have genes just like you and I do, and sometimes bacteria can have a mutation or a change in their gene that can cause them to be resistant to a certain antibiotic, or many antibiotics in some cases. So in this case, we see that the bacteria on the right there was resistant to a lot of antibiotics. And what this tells us is that we finally know what's causing this patient's infection. We did know it was Staphylococcus aureus, but this is a special type of infection called a methicillin-resistant Staphylococcus aureus. And this, some of you may have heard of this, called MRSA, or the superbug. So this one is particularly concerning to a lot of people because it is resistant to a lot of different antibiotics. So we worked through the laboratory. We saw many different parts of the laboratory and many different members of the laboratory team that all helped and touched this patient's sample so that we could give the doctor the right results to help the patient be treated. To do these different types of careers takes different levels of training. There are many different careers and many different options to work in the hospital, and that there are many people that we work with, that I work with every day behind the scenes, that are working in the laboratory, handling patient samples, and caring and treating these patients every day to help them get the right results to diagnose and treat their diseases.